townwide employees, and I am the state president. You're going to be hearing from the local presidents in a few minutes. I just want to give you an update on what's happening in contract negotiations with the Hackensack Meridian health system. We have 4 locals. These 4 locals, collectively, we represent 2,500 nurses and healthcare workers in 3 hospitals and in 1 nursing home. And in the nursing home, we have reached a tentative agreement on a contract, but in our hospitals, we have not. And we've been in contract negotiations for nearly 6 months. So a place where we have a tentative agreement is called Harborage, and that's in North Bergen. And our local there is local 5097. And in Palisades Medical Center, which is also in North Bergen, we represent nearly 1,000 nurses and health professionals at Palisades Medical Center. Here in Neptune, we represent over 1,100 registered nurses at Jersey Shore University Medical Center and over 250 nurses at Southern Ocean Medical Center in Manahawkin, New Jersey. We've been 6 months in negotiations. We have extended contracts, and now we're working without a contract. And these negotiations have been like no other, and I'll tell you why. We're dealing with a healthcare system which is the biggest corporation of healthcare in New Jersey, Hackensack Meridian Health. There is like a level of arrogance that we're experiencing at the bargaining table. Just as we have seen countrywide, there's been a recklessness of pharmaceutical companies for overcharging for vital medications. There seems to be an upping of that ante whenever the demand increases. Well, we've seen a merger of our small hospitals in creating like small systems, and now we see these small systems become large systems, and now we see these larger systems become mega systems. And there is no evidence, in fact, that probably to the contrary, that the access and care is better. I would argue that the only thing we really have seen is that costs have gone up. And we see now cost shifting. We find that that out of network, fortunately in New Jersey, we have a law that helps prevent some of the impact of that. But at the contract table, there's a cost shifting by Hackensack Meridian Health to the backs of our nurses, to the backs of our workers, on healthcare, on cutting their benefits, on increasing co-payments and increasing premiums. And the worst of it to us is that we see salaries of CEOs and administration go up, even to the millions of dollars. And when we say we need more nurses to take care of the patients, we find the answer is we don't have the money for that. And what's paying for these increases in salaries on the administrative level is patient care dollars that belongs at the patient care level. Our nurses are protecting patient care. That is why they are bargaining. That is why they are standing strong. That is why they're doing informational picketing, because they know that patients suffer, and some of them would even die without the proper staffing. These nurses are our heroes. They protect their patients. They deserve everything. They protect our patients not only from sickness, but also from greed. And to join us today, we have some elected officials who have stood by us and have supported us and have come out today to speak to you and to the public about some of the conditions and some of their concerns. First and foremost, we have Congressman Frank Pallone. Standing ovation. He's been our congressman for, I guess, over 30 years. Yeah, I know. Okay. But and throughout his tenure in Congress, he's been He's been a champion on all healthcare issues. He is the go-to guy, and he's a strong, logical voice in Washington. He's always been there for us, and and we're very happy that he is here with us today. So I'm going to turn the microphone to Congressman Pallone and say thank you.
Thank you for those kind words, Ann, and I could say the same thing about you. You've always been out there out front leading the nurses and make sure they get good benefits and good salaries. And it's true what Ann says, that when we talk about good salaries and good benefits for nurses, then that means better patient care, because they are on the front line. They're the ones that are taking care of patients in hospitals like Jersey Shore every day, round the clock. I still haven't gotten used to the, 4 days that you work 12-hour shifts or something like that? Is that 3/12? It's amazing that they would work a 12-hour shift, but that just says a lot about nurses and what they do and how hard the job is. Now, I just wanted to say maybe 3 or 4 things briefly. I remember the strike that we went through, I guess it was in the 90s, I don't know how many years ago, 93. And, at the time I was very concerned because I did feel that the hospital wasn't coming to the bargaining table in the way that they should. And I feel the same way now. We would, obviously, I'll speak for myself and the 3 state legislators that are here, that we want to see this resolved, and we want to see it resolved quickly. We want to have a good contract. We want the hospital to negotiate in good faith. But at the same time, the result has to be one that's good for nurses and therefore good for patients. Anything less will not do. And one of the concerns I have, and I don't know if I can explain this well, I've never been a big advocate for all these big mergers. I have to, I don't like the fact that we have, just a few hospital systems now. Because then, what does that mean? Well, in this case, I keep hearing from Hackensack Meridian that they want to harmonize, the various locals or the various nurses. At some hospitals have nurses, some have unions, some do not. But my answer to that word harmonize, I don't have a problem with harmonize as long as it's harmonized up, right? Yeah. In other words, if you have a hospital system that has a number of units or a number of hospitals, then let's not bring it down to the unit that has the lower salary or the lower benefits. Let's bring everybody up to the unit, to the better salary or benefits that existed. And so, maybe, part of it is that your local is playing this role, I think, of trying to help not only other nurses, but even other health professionals. Because one of the things that you've been insisting on, I think, is a $15 minimum wage, which maybe doesn't apply to you, but applies to other support staff. And so that's an example to me. Harmonize is good, but harmonize up, all right? Not only for the nurses, but also for the support staff. And then the most important thing for me, though, and I have to be honest, is this nurse-patient ratio, right? I feel very strongly that has to be strong. And I know that you're concerned that it needs to be better than it is. And that one of the problems with the hospital system is that they don't want to include that in the contract negotiations. They're saying that should be up to the state legislature. I support the bill, as I'm sure, either at the state or the federal level, that would mandate nurse-patient ratios. But that doesn't mean it shouldn't be part of your contract negotiations and included in your contract, because that's a way of making patient care better and making it, I don't want to say easier on you, but safer. Okay, better quality, safer care. So I'm here to support you because of what you're trying to do. We really would like this to be this contract to be negotiated soon, and we certainly don't want anything done that would suggest that that you can't collect a bargain or that there shouldn't be a union. I would like to see unions at all hospitals, frankly, and you're a good example. So thanks a lot, Ann.
So let me just mention a few things about the staffing part of the contract. As the congressman said, it's not to make life easier for the nurses. It's to make the working conditions and the situations safer for the patients. And there's 20 years of research now and corroborating reports that show that when you don't have an adequate number of nurses, patients not only have longer stays, there's more medication errors, patients actually die. The rate of death goes up. So it is not just a question of what would be nice for the nurses, it's what is required for the patients. And there's one person who is here today that I know gets this because he is the sponsor of a state bill to establish safe nurse-patient levels. And so I'm going to ask Senator Vin Gopal to address the bill.
Thank you, Ann. And thank you, Kendra, for all you're doing to organize everybody today. You know, the studies are pretty clear, as everyone knows. A recent University of Pennsylvania study shows that California, which is the only state in the country that has safe staffing, there are lower mortality that's there than there are here in New Jersey. Every single study we have seen shows that. So I'm committed to you as a sponsor of this bill and the bill I'm doing on CNA safe staffing to do everything we can to get it through. And it's frustrating when we see executives making $3, $4, $5, $6 million while the 2,500 rank and file nurses and healthcare providers here are trying to get a decent contract. And I think that's what's at stake. What these hospitals are doing all over, we see it all over New Jersey, they're gobbling up doctors' practices. They're trying to make not-for-profit system for profit, and that's what's frustrating. So thank you for what you're doing each and every day. Thank you to the leadership of HPAE, and I want you to know that you have a team of allies that are going to be working tirelessly across you. Thank you.
I'm going to go back to staffing again and why it's so important, because we're losing nurses. They're getting injured on the job because there's not enough staff. And then we lose nurses who say, I can't work under these conditions. I could work someplace else in another line of work or another area in healthcare and not hurt my back, not go home crying, and not go home feeling that I haven't done the best job I could do. So we thank you for your support. It means a great deal. And we hope to be, I know Massachusetts Nurses Association are pushing for a ballot referendum, and if it passes in November, it's ballot question number 1, vote yes, and you can put that on your Facebook pages that you support that. If they get it, they'll be state number 2, and we expect New Jersey to be state number 3, and then we think it'll be the national turn. So, but you can go ahead anyway if we don't get there first. Okay. We have 2 assembly people here today who have been our staunch supporters as well, and all the nurses know them because at every turn you're there for them, and we greatly appreciate it. So I normally I'm going to do this, but Assemblywoman Joan Downey, I'm going to ask you to speak. She's a sponsor of legislation to protect patients from falling into medical debt.
Thank you. Thank you so much, Ann. Thank you for all of you. Thank you for all that you do. Thank you, Kendra. Thank you for doing what you do for everybody out there in the hospitals and everywhere that you help. So I wanted to just say, and thank you, by the way, to all of the rest of our elected officials who are here, because without the team that we have, we wouldn't be able to get more done. So one of the things we really wanted to do, besides being in support of safe staffing, is we wanted to make sure that people who are in medical debt don't have their credit ruined for like the rest of their lives and not be able to get a car, house, or whatever else they need in their life, and also just be able to, live their lives without having that over their heads. And what we learned from working with a lot of you here is that it's not just the general public, but even nurses and people who are in the healthcare profession have debt of their own because their health insurance isn't always the greatest. And so that's a huge problem here in the state of New Jersey. And we already, luckily, the governor has been good enough, and we have a great governor on our side, meaning the public side, to try to make things better. And we have a bill to make sure that medical bills are more transparent. That's all terrific, and trying to prevent balanced billing. But also, this bill will make sure that they can't just come after you, the healthcare provider, and say, we're just going to send this out, whatever bill it is, we're going to send it right to the debt collection service. And we're actually making them come to you and try to enter into a repayment plan. Because I think that's the biggest thing that there's an issue with, is that at least if you have the chance, most people who have medical debt want to be able to pay their debts. And we don't want them to be in a situation where they don't get that opportunity or be forced to pay a high amount of money that they can't afford. So this will make it so it's only 15% of whatever leftover income. That means beyond like paying their rent and the important things, their mortgage, the main things in their life, then 15% would be the maximum that they would have to pay per month to be able to pay those bills off. And then there are people who sadly pass away and have this medical debt, and we don't want that medical debt to then pass on to the rest of their family to continue on for the rest of their lives. And the same with people who can't work any longer, who are certified as not as permanently disabled. Because if you can't work and pay your bills, it's not going to do anyone any good to have that, again, just on your credit, you know, so that you can't have anything else in your life. The other thing is, though, you know, we want to make sure, again, that this is all fair, because this is a win-win situation for everyone. The providers otherwise get judgments that are empty, that they can't collect on. And in this case, if they work with the people, then they'll be able to get paid, hopefully in a more reasonable time than they anticipate. And in the end, also, we're able to go on with our lives and not, again, have that burden so that you can't get a car, house, and do, you know, college loans and things like that the rest of your family needs. And more important, you get your medical care, and you're not making that choice, medical care or not. So thank you so much, and thank you for all you do. We stand behind you 100% always, and we'll just keep, you know, hoping that you're going to tell us very soon you come into this great agreement. Don't waive that right to your insurance to be able to make that decision on your insurance. Thank you very much.
Thank you, Assemblywoman.
And we have with us Assemblyman Eric Hotelling. He's a former mayor of Neptune. He's a union member from IBEW, Local 400, which automatically puts him way up here. And he's also an active member of our Labor Council. He has been by our side right from the beginning with no explanations, because he understands the importance of us fighting for fair working conditions. And he also understands that when the conditions are fair for our members and for our nurses, they're fair for the patients. And so there's that great link. So thank you, Assemblyman.
Thank you. Yeah, I just have to say this. You know, I've lived in this neighborhood my last 32 years, and this park has been here. And there's more people in this park now, these last two events, than probably the last 32 years. So thank you for utilizing this park, and they're for great things too, overlooking that wonderful hospital that we have over there. And you know, it's a place I try to stay out of, but you know, when I have to go there, who are you dependent on when you get there? And that is the nurses. I look around here, and you take care of all the patients that go there. People depend on you. And you know, as a labor person my whole life, I do know one thing, that labor disputes are, if you resort to going onto a strike, which gosh, we hope that never happens, there's no winners to that. There's no winners going to come out, I got what I wanted, you got what you wanted. It doesn't work that way. It creates a problem. And you know, one thing that I have found out, and I have always tried to say to my fellow members, that you know, we need to work together in harmony, because to be successful, we have to be successful together. Not one of us can shine if we both don't shine. So, you know, we're there with you. And you heard some of the things that Joanne was talking about, and Vin was talking about, and our congressman was talking about. You know, we're all concerned about these things, and we want you to be successful. And if there's anything that we can do to make you more helpful, or to be part of making that happen in a quicker manner, we will be there to do that for you. So I want to congratulate you all for being here, and thank you. And you know, let's onward to success. Thank you.
I want to also acknowledge that we have two council people with us. We have Robert Lane from Neptune Council. Thank you for being here. And we have Pamela Renee from Neptune City, Councilwoman. And again, they've been by our side whenever we need them. And now the most important, no offense, speaker is hearing from one of the nurses, the nurse leader. She looks different because she's in hospital scrubs, because she's actually working today. She had to clock out to be on her own time, to be here, to share information with you, and that so please give Kendra McCann a demonstration of how much we love her and thank her for what she's been doing.
I'd like to thank everyone for coming. I'd like to thank the elected officials for standing behind us during this fight for a fair contract. As health professionals, our unions at Jersey Shore University Medical Center, Southern Ocean Medical Center, Palisades Medical Center have been bargaining since May with Hackensack Meridian, fighting for safe patient limits, livable minimum wages, and a work environment free of intimidation. On July 31st, our contracts had expired, yet HMH failed to provide us with all the proposals at that point. Establishing standards for patient safety has been a priority for nurses at HMH facilities who regularly meet with administration to review unsafe staffing incidents that occur when not enough nurses are there or other staff to care for our patients. We have reviewed the data, shared our experiences, and given recommendations on how to prevent medical errors and keep patients safe. Yet, HMH has rejected every proposal and has failed to respond to our proposals to set safe patient limits for nursing staff in their hospitals. Additionally, HPAE employees are fighting for a livable, respectable wages for all employees, and they can afford to pay a livable wage to all of their employees, including all of the staff who are not part of HPAE. In 2016, the Hackensack and Meridian merged. They spent $35.4 million on advertising, promotion, and legal expenses and lobbying efforts. It's time Hackensack Meridian put patient health ahead of protecting their corporate wealth. They can afford safe patient care. Hackensack Meridian should put the interest of their patients and their workers ahead of the generous raises for their CEOs and expensive advertising campaigns. Hackensack Meridian Health must put patient health before corporate wealth. I ask that you join Jersey Shore nurses on Sunday, September 23rd, on the picket line from 10 a.m. to 12 noon as we continue to fight for a fair contract and protect patient safety and our rights as health professionals. Thank you.
So thank you everyone for coming out. So we're doing informational picketing. We will not quit. We will not give up. And that is the message that has to go back inside. We're here fighting for the things that will make this hospital great. And until they reach the standard that they need to reach, they will never be able to claim that title. So thank you very much for being here and for the support.
Thank you.
Thank you.
Can we get one large photo? How far in do you need the photos? You're gonna get here.
Do you want to?
Unless they surround it.
Trying to adjust it and zoom in. So
I'm sorry.
Everybody. Yeah. Yeah. Yeah, Kendra right in the middle. All right, everybody make sure your faces pop through somebody's shoulders. Let's see everybody. Tippy toes in the back. Go like so if you can't see it.
Don't even try. Nobody's going to see it.
Who's that?
Peggy, shut.
Peggy, come around. Amy,
There she
come around. I
goes.
can't see
All
them.
right, come on up. Peggy.
Amy, come around front if you could.
Ready?
There we go. Okay, everybody.
Yeah.
I am. Yeah. Oh, that looks great.
Look angry.
We must have crossbows.
Mean.
Thanks. Yeah, how's everything? Red Matt, you ready?
Excuse me, you want to add any more comments than what you already said?
We would like a fair contract, Hackensack Meridian Health. We want to give proper care and safe care to the patients. It's all about patient safety. Thank you.
Thank you.
Probably like an eavesdrop. I can hear it all. You can?
Does anybody have the stakes for this in their car?
I have a couple.
We can use one.
Yeah, I'll be right back.
Maybe if there's a few. We can.
Always lived in Neptune. Up on all corners. You know what I'm talking about?
Yeah.
So my cousin nice to meet you. So I'm in support of it. Yeah. You know, everybody else. You're not. I don't know why you're not. For the nursing home. Well, that's for the NA, but we'll get on it. I don't know why. I think that was a mistake. Is on there already. I think it was a mistake because we would have been on it if we would have realized. Okay, sorry. Oh, that's okay. Thank you. All right, it's like we're going to get on it, right?
It used to be an orange coming in here because this was the Asbury Gables. This was the overflow from Asbury. And I live in the original home. And one of the houses over there was originally not to get up the house. I had a house, not storage, and a building in front of it. These houses were built in the late 20s. They were depression, they were pre-depression. And when the depression hit, they stopped building. So the 17 homes that got built, and the rest of them were all custom.
Right. Because they're all different.
Yeah, they're different. Yeah. But there were 17 houses built, and you know, I've been in a lot of them, and all had very similar with the trim. Fireplaces are the same. Built like 30. I still have the same.
Why have to change the air conditioning?
Hey Vin, do you have any more comments that you want to add?
Yeah, we got to support safe staffing. We got to get it through.
Yeah, I haven't done that yet.
All right, Ben. See you later. And thank you so much.
Thank you so much.
Thank you so much for your support.
Hey, can you make sure? Where's the guy? Where's George?
I know good painters, but I don't know.